future nurses, it's Kafayat Kemisola here, and in today's video I just want to share with you some common nursing interview questions and answers, like the right answers to give, because this thing can be scary. Like, actually, nervousness, you don't know where the question might come from, you don't even know your interviewer, but there's nothing impossible. If you bear in mind that you can do it, you will certainly do it. If you see it as possible, then it's possible. Please and please, dear aspirants, there are two major things that you should work up for. That is being calm and confident. If you have these two things, definitely you're going to push. So watch this video to the very end, because towards the end of this video, I will share with you some valuable tips that can help you ace your admission process. They will help you shine during this critical phase of your application process. Let's get started. And let's start with the most frequently asked question: why did you want to become a nurse? You see, this question on a scale of 10 is rate 9. Almost every nursing interviews has this question in it, because there must be a reason why you're choosing the profession. Come closer, let me tell you a secret. Answer questions uniquely. Don't go in a common way. Don't just go on and say, I want to be a nurse to save lives. Of course, everybody will love to save lives. To give a valuable reason why you've chosen nursing as a profession, give your genuine passion. What motivates you? There must be something that you've seen that make you want to say, yes, I want to become a nurse. For example, you could share your own personal experience where you witnessed the profound impact of nursing care on a loved one, maybe your parent, your sibling, on a loved one, and how that inspired you to choose the profession. That kind of thing is thrilling and is not common. It's unique because it is your own personal experience. So share it. You can even spice it up with, you want to earn a decent living out of nursing, like you want to maintain your financial balance, because you can't escape the fact that money is involved, right? And the next question is similar to why did you want to become a nurse. The question is, why did you choose nursing out of other professions? Like, why did nursing supersede those professions? There are many science courses, science professions that you can go for. Why nursing? This kind of question, calm, you can answer it. You just have to give thoughtful responses. You can just say, for example, nursing provides diverse fields of interest. For example, if you don't want to be a pediatric nurse, you can be a psychiatric nurse. There are different kind of fields whereby you can choose from, and with that, you'll be able to provide specialized care to diverse patient population. So that is that. The next question is, where did you see yourself in the next 3 years, in the next 5 years, in the next 10 years? It depends on your interviewer's choice. This particular question was actually directed to me during my own interview. This type of question, you just have to demonstrate your long-term commitment to the nursing profession and your desire for growth. For example, you can say, in the next 5 years, I envision myself as a skilled and compassionate nurse, registered nurse, actively contributing to the healthcare field. You can go on to say, I would love to further my education in order to enhance my nursing practice. You can talk about advocating for helpless patients. All this stuff, you can also spice it up by saying what you would love to be in the next 5 to 10 years. Try as much as possible to tailor your response with your own aspiration and goals. Ensure that it aligns with your genuine interests and the specific nursing program you're applying to. Try to showcase your dedication, your ambition, your passion for making a difference in the nursing field. Another common question is, what are your strengths and your weaknesses? See, if you are talking about your strength, make sure that you talk about the qualities you have that is related to nursing, that aligns with nursing. Something like, talk about your compassion, how compassionate you are. Talk about your strong communication skills, how you are able to communicate in terms of, your patient, nurse patients and everything. And talk about your ability to adapt in any kind of situation. Then, in terms of weaknesses, about how you love to accomplish things faster, all those kind of things that brings growth. To mention some specific strategies that you have used to overcome challenges in the past. Mention those things that you've used that have helped you, how you're able to overcome any kind of situation that might be bothering you or weigh you down, how you don't allow anything to weigh you down, you move. Another possible question they might ask you is, Tell me about yourself. If you're being asked this type of question, you don't have to mention anything that is already in your credentials, like maybe your grades in primary school, your grades in secondary school. You already added that to your file, so they've seen that, they've gone through it. They don't want to know about the things they already know, so they want you to tell them something new, something unique about you, about what you love to do, your ambitions, your goals, what you love to accomplish in so years. You don't have to mention your name. You don't have to say my name is this, I'm so years old, and no, those things are already attached to your what, credentials. So you don't have to mention that. Just go straight to something different. Say something different about you, something interesting about you. Make sure that you don't overshare your personal information, and just mention those things that you have on a normal day share publicly. Talk about your hobbies, your dislikes, your likes. Yes, you can say something you love to do, something you wouldn't want to do. Finally, for the question and answer phase, it is your own question to the interviewer. It is important you ask a question after your interview. It shows your curiosity, it shows your genuine interest in the nursing program. You just ask about clinical experiences, faculty support, research opportunities, anything you are curious about. You should just go on and ask. Other questions that you are likely to come across, but these are the most common questions. I will leave other questions in the description below, so try to go through them and practice. Now, onto the valuable tips that I have for you. Firstly, be at your interview site early, at least 30 minutes early. Secondly, maintain eye contact. Look your interviewer eyeball to eyeball, like that confidence. Make sure you have it. Next, dress appropriately. That kind of dress sense that is morally acceptable, decent, nice. That kind of dressing that this one is 100%. Make sure you're looking kept, like you don't want to look unkept, right? Make sure your nails are trimmed. Don't wear all this shine clothing, all those kind of clothing that can be distracting. Go on applying makeups, all this tight fitted clothing. Just do away with them. Not necessarily loose clothing, but at least just normal. Then don't go on and wear high heel shoes, all these coco shoes that you just be making noises around the premises. Wear shoes that doesn't make sound at all. That is much more preferable. Then wear something you are comfortable in. When you're not even comfortable in your clothing, your shoe, how will you be able to talk and give right answer? Dress in a way that you will not be affected. Then use confident body language. Like I told you in my last video, talk confidently. Your body should be moving, don't just stay stiff. Make sure you are using your body language. Then I have one thing for you. Whenever you are answering questions during your interview, you don't have to talk about what is already in your credentials. Your interviewer have already gone through them, so you don't have to go again. Just talk about new things. Also, when you're being asked a question, make sure you keep on talking, like giving much more explanation until your interviewer cuts in. Try to create much more ideas, more points. Make sure you're explanatory in your answers until your interviewer say next question you get. That shows how strong your communication skills is. So that's just all about it. Just be yourself, showcase your passion, and let your dedication to nursing shine through. So endeavor you go through the description below in order to get to see more nursing questions that you might come across. So if you find this video helpful, try to click on the subscribe button below in order to support the channel, and share this video among your friends, your colleagues that will find this helpful as well. See you in the next one.